we go. So hello everyone, today you are at the Possability People Direct Payments Feedback Report webinar. My name is Tasha Bearfield. I'm the Engagement and Co-Production Lead with Possability People. Been doing this bit of work for the last few months and listening to people around their experiences of direct payments. And I'm joined by Cass.
Hi everybody, my name is Cass Watson. I'm the Community Engagement Coordinator and I've been involved in putting together this little report on the basis of the work that Tasha has put in.
Thanks, Cass. So we're just going to give you a bit of an introduction to what are direct payments. We didn't want to make an expectation everybody knew what they were. Direct payments, generally, you can be given a personal budget to spend if your local council decide you're eligible for help with any social care and support that you need. There are some restrictions on that, so you would need to speak to your local council about what is and is when you are not eligible. The money in your personal budget will be paid to you or to an organisation that helps support with that personal budget. The idea is that it will help you make more decisions about how that money is spent and spent on things that you need it for. And this is known as a direct payment. We did this consultation because we were hearing more from our beneficiaries that there were problems with direct payments and the way that they were being administered in Brighton Hove. People reported being encouraged to use direct payments when they were not suitable for their needs. People were also really struggling to manage them and were reporting that they didn't have the support they needed to use direct payments effectively for them. And this included carers as well. So the methods that we decided to set out to use, we have not been commissioned for this bit of work. It's just a bit of work that we thought was really important as part of our engagement work. So we decided we would use a survey, in-person drop-in and a Zoom workshop. And these were completed between the 22nd of October and the 13th of December 2024. The survey went out to over 500 people and organisations in the city. And we asked questions in the online survey and the workshop, things like what was the application and assessment process like, finding and employing PAs in that process, and how well direct payments are working generally for people. Are they the right option? We were also informed when we started this that Healthwatch had also completed a direct payment survey commissioned by Brighton and Hove City Council in June 2023. The conclusions from that and recommendations from that report were to have increased contact with assessment council services, including a dedicated social worker, and reference to the need to improve the financial elements, including the assessments. The second one was better advice and information, and this included advice regarding managing PAs, where to access training for PAs, as well as general support regarding using direct payments and who to contact. And the last one was around access to personal assistance. Respondents stated how hard it can be to find personal assistance, support for PAs is needed, and the need to pay PAs at a reasonable amount. And I just put that in there because I think it's important to reflect that the piece of work that we did wasn't the first time that this has been done. And I did ask and went back to Healthwatch and said, were there, what changes have been implemented as a result of your conclusion and recommendations? I haven't heard back from the council or Healthwatch yet about which of these areas have been worked on, but I think it's very important that we hold this in context that we were doing this bit of work 18 months later. And actually, I think as you'll find, the survey and the feedback probably stated very similar conclusions, which is a bit disappointing, I think. I'm going to pass over to Cass now.
Yeah, so we thought it'd be best to just sort of give you the quick headlines on the findings that we had, just so that you can leave here with a nice, straightforward overview of the kinds of response that we got. 74% of respondents reported that direct payments were working somewhat or very well for them, which is pretty good. Respondents who did report frustration with the process indicated a difficulty communicating with agencies that were used to facilitate the direct payment process, as in terms of getting a carer, or the council. 42% of respondents reported a negative or a very negative experience trying to find a PA. This was often considered to be the most difficult part. We've actually got a few examples of the kinds of experience that people have had coming up, but it was often found to be quite a sort of like quite involved, quite a difficult process. Respondents who reported frustration with the PA services themselves, as in rather than trying to find a PA, having already got one, found that the PA services found that pay was too low to keep PAs, and so resultantly retention was difficult, and the organizational work was too reliant on the service user to be a meaningful relief for the carers. We're going to see a lot of that as we get into the feedback. So first, before we really get any further into it, who responded? We received 31 responses to the surveys, which can be broken down as follows. 94% of our respondents live in Brighton, with 3% in Peacehaven and 3% in West Sussex. I believe that corresponds to about one of each response to the contrary. So about 29 responses. We are almost entirely in Brighton for this report, which is obviously a limitation of the kinds of experience. It would be nice to get a little bit more of that rural perspective too. Of the people who were making use of the survey, most were receiving direct payments themselves. That's 55%. And then 42% were carers for someone trying to get or receiving direct payments. A lot of these carers, in fact, were usually adults of children who would benefit from direct payments. And trying to get direct payments constituted 3%. Again, another one instance probably there of someone who is trying to but has not currently got direct payments. So first, one of the questions that we did ask was, are direct payments the right option for you? Do they feel appropriate? The majority of people, which is good to know, did in fact say yes, with 10% saying no, which is maybe 3 responses, and 10% saying that they had no other option, which is probably another 2 or 3 responses. Again, the amount of people who responded to each question is variable because we didn't make any of these questions mandatory. I believe we had 29 responses for this data set. 20% of people has either said that they were not appropriate or that they had no other option, which indicates that there is some frustration. We had a few other responses here. Here are all 3 of them. That they would be the right option if there was more flexibility around what they could pay for, rather than necessarily being, for instance, for applying for PA services, if they could be some sort of bursary that could be given to people to support them across the board, probably more in the line of benefits here. Another person said, I don't like the way that they are managed. And a third person said, whilst there is some degree of choice about what they can be spent on, it is an arduous and time-consuming process trying to get clarity about this. This is something that we find consistently, is that people were not entirely clear on what their rights were, what was appropriate for them in the process, what they could ask for and what they couldn't. So why aren't they right for you? Asking people who said that no, they were not appropriate, why they are not right for them. I'm just going to read this quote in full because I think it's very useful. In the 4 years that my son has had direct payments, we have found it really difficult to recruit, train, and retain PA staff. The amount of time I spent doing administrative work for this cancelled out any benefit. It's the parent carer's role to write an advert, advertise, monitor, and respond to replies, speak to applicants, do interviews, arrange paint work for stating, endlessly chase up DBS checks, even for people already working in school in Brighton and Hove who had a current DBS. A ridiculous amount of work for extremely little respite from my caring role, which is the original purpose. This is one of the most consistent pieces of feedback that we had, was that the process was really, really involved for carers who were trying to support someone else. And so resultantly, as much as it was good to have the money, as much as it was good to have that support, the amount of the work that was put directly on the shoulders of the carers meant that actually the overall responsibility on them really wasn't lifted in a way that felt meaningful. This is something that we'd look to redress. Cool. Could I get the next slide, Tasha? Yeah, so here's another example of what people thought was about why it wasn't right for them. Whilst there is some degree of choice about what they can be spent on, again, it is an arduous and time-consuming process to try and get clarity about this. Also, whilst payroll is appreciated, recruiting is getting harder. The lack of training and support for PAs is extremely frustrating. Some PAs have been very good, others lack motivation and ambition for my disabled child. The rate of pay remains poor. So these are the kinds of difficulties that we have. We have inconsistency in terms of the quality of care that people feel that they are being provided with. The amount of pay that they are being provided with as a result of the direct payment scheme is felt to be inadequate, and that the process itself is hard graft, to say the least. Cool.
Thank you, Cass. Next, we talked a bit about who was involved in your direct payment application and process. And so I don't think unexpectedly you would see lots of social workers were on there. Possability people were on for some of them. Nurses, People Plus was probably a lot smaller than I would expect it to be. NHS prescribers and also early years and school staff probably for the parent carers that completed the survey. So this was an interesting question. We asked, have you been offered an alternative to direct payments? Making a presumption that direct payments are suitable for everybody is not the case with the people that we spoke to. They're definitely not suitable for some people. And if they are suitable for people, a lot of people need a lot of support to use them, which probably mitigates the benefits of having direct payments. So 71% of people said they weren't offered any alternative to direct payments at all. 16% said yes, they were offered an alternative. We didn't ask what that was, but in the other category, people put various comments here around what alternative, there isn't one. They don't know or they don't remember. Someone said they were under sovereign cabin care for a few years, but they've been on direct payments for approximately 12 years. So yeah, there's some people, they've been on direct payments such a long time, they may not remember back to the assessment process when they might have been offered a different alternative. And someone said there was a half-hearted attempt to use provider services, but they seemed incapable of offering a person-centered option. And I think that might be a reason why lots of people think direct payments are the right option for them, because they get to decide exactly what care they want, when they want it, and who's going to deliver it. But as we have seen in the survey, it's a lot more complicated than that, unfortunately. So we asked question, how well do you feel direct payments are working for you? And actually, most people, as Cass said in the summary at the beginning, most people said very well or somewhat well, and I think that would be expected. I guess what we're concerned about is the percentages of people that it's not working well for, and that's probably around a third of people it's not currently working well for, which is a bit of concerning. It's either not working very well or not working at all. And I think those are probably the people that we need to make sure that we're including. So there's a level of accessible offer for everybody that needs any type of support. We asked, excuse me, oh, my voice is going now. Excuse me a second. We asked a question about where's our help needed? Oh dear, my voice. Several respondents outlined issues with our PA notice board functionality, which we appreciate that feedback. Just regarding the quality and the regularity of carers, we did get some feedback that unfortunately there isn't always carers that are suitable for someone's needs. 25% of those who did not use a service or agency to find a PA did not even know these services existed, which is quite a high percentage, I think, to know that there are services and support offers out there. 60% of those did not believe direct payments were appropriate for them directly, cited difficulty in recruiting for and sustaining PA roles, as Cass has already said. And 30% of respondents indicated a negative or very negative experience with the initial application for direct payments. And that was just around the bureaucracy, I think, of actually going through the application process, having the capacity and the energy and the skills to be able to do everything that was needed to be able to set direct payments up in the beginning in the first case. So a respondent experience here says it's very difficult to find information, to find eligibility criteria, to understand the processes for arranging payments. Very confusing with so many different organisations involved. Horrendous system for sorting out DBS checks, take unreasonably long time and lots of delays, lots of additional stress on top of already having a disabled child. And that was echoed quite a lot through some of the comments that we had. And someone saying that the PA notice board is not really working. There needs to be another way to find PAs as well. I'm going to pass over to Cass.
Yeah, so in terms of what we can do, I had sort of few thoughts as we were putting all of this together. One of the things that seemed pretty straightforward to me was making sure to work where we can in a joined up way with Brighton Hove County Council. In particular, centralising resources supporting carers with the recruitment process. As much as possible, we really do want to, hey, take care, Ian. As much as possible, we do want to make sure that all of the information that people need to access and make use of this process is at a single point, that we can refer people directly, ideally to a single hub, so that when they are engaging in this process, they receive all of the relevant support, both in terms of how to actually go about an application, how that money can be spent when they do have it, for instance, and what sorts of resources there are available, for instance, in the charity sector through Possability people and others, who can help them with that process, who can aid in that way, because as mentioned, a lot of people didn't know, for instance, that these services existed. A lot of people were not aware of or spent a long time becoming aware of how much money or how money could be spent. And just putting all of this in one place could really make the process a lot more useful for a lot of people, save people a lot of that time-consuming element. So yeah, considering options for supporting carers during the recruitment process. This is something that we would have to probably speak more proactively to carers about, which is why later on I've got gathering feedback from carers about why they sorry, not carers, gathering feedback from PAs about why they leave the roles. This is something that we really want to try and expand as much as possible. Anything that we can do to, for instance, create a doc of reliable carers that PAs that we can consistently vouch for, would be very, very helpful. Obviously, that there are going to be difficulties and limitations with the amount of work that this puts on us, especially considering that this piece of reporting is itself uncommissioned. Publicly communicating what services are available and compile and share resources. So there are a few organisations mentioned by name in terms of who have been interacted with in the process of trying to get a PA, of trying to make use of direct payments, for instance, and some of those are from different sort of public sector roles. We had one instance actually of someone making use of I think it was a school nurse in order to support them with their direct payment journey for their child. Some have been through clinical pathways, others have been through the third sector. Making sure that all of the people who might be relevantly placed to be recommending direct payments, to be supporting people with the direct payments, are talking to one another and sharing the resources that they have about what is available for the people who are making use of these processes would be really, really helpful. Another final thing that would be really, really helpful is in terms of gathering feedback from social workers, for instance, who are supporting these DP applications, and to see where the barriers are. You know, in terms of the process, in terms of how it is supporting someone making an application, the way that the forms are structured, the sort of basic realities of doing an application for direct payments in order to support someone in the long term with a PA or, you know, with whatever reimbursement. These are the things that we need to get a more direct handle on. And this would probably be, if I were going to project the work a lot further, these would be the kinds of questions that I would be thinking we'd be asking next.